Hi friends, I am Dr. Dattaram. I am a consultant surgical gastroenterologist and a laparoscopic surgeon practicing in Hyderabad. So when it comes to inguinal hernia, which is a very common type of hernia which I treat, it's almost like a daily surgery for me. So when it comes to an inguinal hernia, most of the patients ask me whether it's good to go for a laparoscopic surgery or a open surgery. So, laparoscopic surgery, as you all know, has several advantages to the patient, which that's why it looks very attractive. So, you should know the difference between laparoscopic surgery and open surgery. So, inguinal hernias by laparoscopic method is the standard of care world over, and the surgery has several advantages, as I mentioned before. Laparoscopic surgery, as you all know, is also known as minimally invasive surgery. So wherein the cuts made are very small with the help of small instruments, with the help of ports we access the organs inside the abdomen and the surgery is performed. Pain of surgery after laparoscopy is very minimal because the cuts made are very small, and because of less pain patients recover faster. They resume their physical activities much faster than open surgery. They go to office earlier, they get out of the hospital much faster, and many patients actually tell me that they have no pain, or very minimal pain. So this is the main advantage of laparoscopic surgery. Very specific to inguinal hernias, if you have bilateral inguinal hernias, that is right side and left side inguinal hernias at the same time, then laparoscopy is the best, because for open surgery you need to make two large cuts on either side. So whereas in laparoscopy with the same access, same three ports, both the sides can be repaired. So that is the beauty of laparoscopy. Not only that, when we do laparoscopic surgery, we dissect something called as a pre-peritoneal space. The entire potential weak area, that is called as myopectineal orifice. The entire myopectineal orifice is reinforced with a mesh. This prevents hernias from any of these potential sites. This is yet another important advantage the patient has when he opts for a laparoscopic surgery. Another important advantage one has to look at is the wound. So because the wounds are very small in laparoscopy, there are no or very minimal wound related complications like wound necrosis, that's wound becoming dark, or wound infection, etc. Above all, it's a recovery which the patient has. So laparoscopic surgery patients recover very fast. They have very minimal pain. They can walk the same day and they can go home faster. They can resume their office and physical activities much faster than in open surgery. But laparoscopic surgery, one has to be fit for general anesthesia, because laparoscopic surgery we almost always do under general anesthesia, whereas an open inguinal hernia can be performed under spinal anesthesia. That is, the patient is awake during surgery and only lower half of the body is anesthetized. Patients who are not fit for a general anesthesia can choose to undergo open surgery. So if you look at the recurrence of inguinal hernias, there is not much of difference between lap and open inguinal hernia repair. And if the patient is not fit for general anesthesia, open surgery can be performed for such patients. So many patients, when they ask me, when they are not able to choose between laparoscopy and open surgery, I always advise them to go for laparoscopic surgery, because the procedure is standardized, has many advantages, and bilateral hernia repairs, that is both side hernia repairs, can be performed with the same small cuts, whereas open surgery is not. So the patient asks me which is better, laparoscopy or open for inguinal hernias. I would always say that laparoscopy is better for inguinal hernias, because the recovery is much faster, pain is much less. Both side hernias can be repaired at the same time with very small cuts, with the same small cuts made, and also a wider area can be covered in laparoscopic surgery. Thank you so much. So if you like the content, please like, share and subscribe. And if you need to contact us for any further information regarding the same, you can always call or WhatsApp on 98954 37059. Thank you so much.